Hello, I am Dr. Raghuram. I am a pediatric Haemato-Oncologist at Aster Group of Hospitals, Bangalore. Today I want to let you know about sickle cell anemia. Sickle cell anemia is one of the most common hemoglobin disorder in children throughout the world. Usually this is because there is an abnormal hemoglobin. The red blood cells will become sickle cell shaped, and then they occlude the artery. That means they block the arteries and cause problems. Most of the times these children will present with bone pains, especially in the fingers or in the chest or abdomen or in the limbs. Sometimes they may have low hemoglobin, anemia, or they may be prone to more infections and need repeated hospital admissions. Most of the times these children are treated symptomatically and conservatively. That means they will need lot of fluid intake, that either by mouth or by giving IV fluids. They will need painkillers, they will need IV antibiotics. Sometimes this can affect the chest and child may need oxygen or blood transfusions. These episodes are treated acutely in a hospital, and if the child is needing repeated hospitalization or having problems again and again, we will start them on medication called hydroxyurea to reduce the incidence of these things. Sometimes some of these children may need repeated blood transfusions, or some children may be put on regular blood transfusion or an exchange transfusion to reduce the symptoms. And the only curative treatment for this is a bone marrow transplant. And the bone marrow transplant is not done in all the children with sickle cell anemia, but those children who have severe symptoms or severe disease, like having a repeated episodes of bone pain, or who has got acute chest syndrome or repeated hospital admissions, or which is affecting their growth, these children will benefit from a bone marrow transplant. And in a bone marrow transplant, usually the bone marrow is taken from a donor, and the best donor would be what we call a matched sibling. That's a brother or sister who is a match, or they can be done from an unrelated donor, or we can do it from one of the parents. And this procedure is entirely safe for the donor, and they can donate the bone marrow even if they are a carrier for sickle cell anemia. And the children who undergo bone marrow transplant with sickle cell anemia will be completely get rid of their symptoms. They need to be live near the hospital for a period of about 3 to 6 months, and after that they will go on to lead normal lives. This bone marrow transplant can be done in all the hospitals of Aster in Bangalore, and we have got a dedicated pediatric bone marrow transplant unit which caters to these children.